This video will discuss Ativan and Versed updates. We'll review Ativan Removal and the decision-making process behind that. We'll talk specifically about using Versed for anxiety, which is what most people are upset about by losing Ativan. We'll look at the updated guidelines, like which guidelines are affected by the removal of Ativan and placement of Versed. And then we'll just do a quick drug review of Versed. Ativan Removal. We want to address people's frustration and the loss of Ativan. I myself, I love Ativan. I think it's a fantastic tool. But I'm hoping by the end of this video, you will be confident in using an updated dosing of Versed and that you'll use it in the same situations in which you would have used Ativan. So Ativan's not really utilized pre-hospitally. That comes down to three major things, kind of the same as always, but cost and man hours, which is really cost as well, and then refrigeration requirements. So the cost, because we're not refrigerating it, we have to throw it away every 60 days. You have to throw the medication away. With that, there are associated man hours to do the outdates, tracking, etc., etc., etc. Additionally, that makes people's job more difficult, and ultimately we're trying to go the other way, make people's job easier and more enjoyable. Lastly, I just want to point out that we did add Ativan at a time in which we used refrigeration. I think ultimately, dropping the refrigeration and the tertiary drug box is really beneficial. It makes everyone's job easier. There's not a third bag to carry into the house. You have all your drugs with you just in your normal bags. Let's talk about Ativan versus Versed. So yeah, I understand Ativan is a much simpler drug to use. The dosing is easier. Giving it in maybe too large of a dose rarely has the same sort of negative outcomes that you would with Versed. But what I want to point out is, ultimately, they're the same drug class. They work very similarly. There's just a small chemical change or chemical makeup. That's why they're a little bit different. But you're really getting the same result. Using Versed, though, does require more caution. And we'll talk more about this, but if you change the dosing and you change the speed in which you administer, like the length of time in which you administer the medication, you're going to have a very similar effect, a similar outcome, and a similar side effects package that you would using Ativan and Versed. These are the following guidelines in which Ativan has been removed from. I want to take the time to break down each one of these and talk about the situation in which Ativan was being utilized and what you should do instead. As a reminder, these guidelines have been updated at the release of this video. M13, Behavioral Emergencies and Combative Patients Guideline. Ativan was being utilized here as a secondary or second-line medication for these patients. You've already given ketamine, the patient is resistant to that, and they are still combative, and then you want to move to adding benzodiazepines. It doesn't specify whether you should use Versed or Ativan, so let's kind of discuss that. The real benefit of Ativan over Versed is that it lasts longer, so you don't have to redose. However, it has a much longer onset time, right around 3 minutes or so. So really, you shouldn't have been using Ativan in this situation anyways. Really should be a ketamine Versed package versus a ketamine and Ativan package. M14, sedation for painful procedures. Ativan is being utilized for sedation. Out of the options here, ketamine, Versed, and Ativan, I think Ativan is actually the worst choice. This guideline is really to provide direction for a temporary need for sedation for a painful procedure. An example would be you have somebody with an injured limb that has no pulses that you're going to align anatomically in hopes to return pulses, so you don't need long-term sedative. Number one, that's why Ativan's bad. It has a long half-life. It lasts a couple of hours. Two, Versed provides retrograde amnesia, about 30 minutes or so they're going to forget the procedure happened. And three, the negative side effects of giving somebody a lot of Versed, such as loss of respirations or drop in pressure, really are kind of mitigated. When people are in a lot of pain, there's a huge catecholamine dump, and their vital signs really do maintain during the situation versus someone who's really shocky. OB2, obstetrical emergencies. Ativan was being utilized here for seizure control. This is for the eclampsia patient. That's a pregnant woman who is actively seizing. One of the options is giving benzodiazepines, and Ativan is an option. If you're given an option between Versed and Ativan during seizures, you should never choose Ativan because of the long onset. Versed works much better and much faster at breaking seizures than Ativan does. PM8, Detox emergencies. Ativan was being used for its sedative properties in this guideline. It says hyperdynamic state, but really that just means like an overstimulated, very overactive state, so you need to sedate the patient. Again, I think Versed is superior here in the sense that it has a much faster onset, even though duration is longer. As we talked about before, you can really mitigate the respiratory and blood pressure compromises by giving the medication over a longer period of time and diluting the medication. C3, general cardiac care. Ativan was being utilized for its anxiety properties. As discussed earlier in the video, we'll talk about an updated dosing and a duration of giving an administration of the medication to have a very similar effect once you can use Versed in place of Ativan for anxiety with really good similar effects. Versed anxiety dosing. You're going to give 0.01 milligrams per kilogram up to a max dose of 1 milligram. A couple examples here. If the patient is 50 kilograms, you would give 1/2 or 0.5 milligrams. For a 100 kilogram patient, you're going to give 1 milligram. We're not going to cross the 1 milligram mark. So if they're 130 kilograms, 140, still start with 1 as the maximum dose. For the routes, IV, IO, IM, IN, I really want to focus on the IV and the IM route. First, the IV comes on almost immediately with really a good onset time, about a minute. Somewhere between 60 and 90 seconds, but I want you to think about a minute just for easy memory. If you give this over several minutes, 1 to 3 minutes, you're really going to mitigate the potential for lost respiration and hypotension. For IM, you can give them IM, onset's a little bit slower in the 1.5 to 3 minute mark, but you're going to have a very similar effect of Ativan IV. Meaning, I give them IM, it's going to come on in a similar time as Ativan, and really going to mitigate most of the problems with them not breathing or a drop in pressure. For indications in reference to anxiety, you can give it for general anxiety, the same way that you would have given Ativan before. Just use that 0.01 milligram per kilogram, and again, if it's IV, give it over at least a minute, and IM will kind of mitigate those effects. For BiPAP, I want to take a small time to focus on this. We're going to half the dose, meaning that the range would really be, for this 50 kilogram patient on the example up top, would be 0.25, not 0.5. And for a 100 kilogram patient, it wouldn't be 1, it would be 0.5. When someone is kind of what I consider to be on the line or big sick, we want to give them less and more doses so we don't push them over the line and maybe then require intubation. And I put down here miscellaneous. These are just a couple of examples. Chest pain, CVA. Someone's having a giant MI. They're aware that you can die from that. Reducing the anxiety will then in turn reduce the myocardial oxygen demand and give you a benefit for your patient. These are just 2 examples. There's a lot more examples than this. Versed guideline changes. So review from the previous video for the M5 adult seizure. The dosing for Versed has been changed to 2.5 to 5 PRN. What's being updated for this video is M14, sedation for painful procedures. The IM dosing has been reduced from 2 to 10 milligrams to 2 to 5 milligrams. Other than that, there are no changes for Versed. Versed review. We're going to review this from a drug card standpoint. So let's go through it. Mechanism of action. Versed, it is a sedative. It does that through GABA. As a reminder, GABA is the major neuroinhibitory transmitter. If acetylcholine is the gas pedal, GABA is the brake pedal. Dosing, we'll just go through it again. Seizures is 2.5 to 5 PRN. RSI induction, 0.1 milligrams per kilogram for the IV dose. Anxiety, 0.01 milligrams per kilogram with a max dose of 1 per dose. Onset is in that 60 to 90 range. Think about it as being a minute just for easy memory. Duration is between 15 and 30 minutes. The range is because it depends on so many things, such as perfusion status, age, renal status, etc. Some additionals here. The hemodynamic effects of Versed are really dose dependent and the administration time dependent. So if you give it over a long period of time and a smaller dose, those hemodynamic effects are well mitigated. As an idea, or as a reminder, it does reduce the SVR, or systemic vascular resistance, meaning that it dilates the blood vessels. And as a good thing, it has about a 30-minute retrograde amnestic, meaning they won't remember anything 30 minutes prior to having the medication. Versed cautions. Let's look at the side effect precautions profile for Versed. For geriatric or older patients, I want you to think about a reduced dose. This is provider discretion dependent on reducing the dose. Most of these people have impaired renal and or impaired hepatic function. That's really saying that they have a reduced ability for their body to clear the drug. Next, CHF. As a memory tool, think about it as a twofold clearance, meaning it takes them twice as long to limit the medication than someone of the same age that doesn't have CHF. Versed is excreted into the breast milk, so really weigh the option, or the need rather, to give somebody Versed that is breastfeeding a child. Benzodiazepines are a pregnancy category D drug, which means that they do cause harm to the in utero infant. And lastly, if you give narcotics and benzodiazepines together, they are synergistic, meaning that they work to make each other stronger. Just some things to consider about Versed administration. This concludes the Ativan Versed update video, and the answer to the question is 11.